Hello, my name is Pragya Chaudhary and I am a member of Health Needs RX, an organization with a mission to mitigate health disparities through educational video content and information guides on essential topics like chronic diseases, mental health, respiratory illnesses, health literacy, and more to help people optimize their health. We also strive to spur discussion on health disparities and the state of them today through our blog Medquity and this very podcast, Discussing Disparities. Today, I am joined by Dr. Nikita Rabelo, who will talk more about the health disparities faced by Latin Americans. Thank you so much for joining us today.
Thank you for having me. This is definitely a great opportunity to address some of the issues that burn the Latin American community. In order to better recognize these issues, we must first understand our community and its diversity, and we want to acknowledge the difference between being Latinx and Hispanic. Latinx accounts for Latin America and everybody that comes from Latin America, and Hispanics account for Spanish-speaking backgrounds or individuals that are Spanish-speaking. Thus, not all Hispanics are Latinx, and not all Latinx are Hispanic. For the purpose of this topic, we will be using Latinx and Hispanic as interchangeable terms, but we do acknowledge the difference. Hispanics make up the largest and fastest growing minority group in the continental US. We are close to 58 million. So Latinx are the principal driving force behind the demographic growth in the United States. We account for half of the population growth since the year 2000. Our community is not only growing, but is also diversifying. We are a very big group, and Mexican and Mexican Americans remain the largest population inside the Latinx. But there have been shifts toward immigration patterns over the past decade, indicating a steep increase in Latino populations or Latinx populations arriving from the Caribbean, Central, and South American regions. While this is happening, the Puerto Ricans are being the second biggest population group.
That's incredible, and it's good that we have defined that difference with Latinx being people from Latin America. Hispanics are just anybody from a Spanish-speaking background, and it's good to know that we will be using those terms interchangeably. And yeah, it seems like it's quite a large population. It'll be interesting to see the health disparities that this community faces. Speaking of, what are the health disparities that Latinx people face?
Oh yeah, it's a really big population, and we're mostly like clumped together into one big group, and that's what most people don't realize. So it's great that we get to talk about this and point out all the differences. Most of the healthcare disparities impacting the Latinx community are influenced by socio-demographic behavioral issues and societal factors, including language and cultural barriers, as well as lack of access to healthcare and structural discrimination. We need to identify these disparities, and in order to do so, we must dissect the causal root of these issues. And what are these? First of all, the Latinx population has a wide phenotypic and genotypic variance. As I mentioned before, we are a very big group, and because we are considered an ethnic group, we can be counted or can feel identified as part of any quote-unquote race. Inside the Latinx community, there is a significant genetic heterogeneity, and it's due to colonial origins in continents outside of the Americas, especially seeding from Europe and Africa, and differential levels of admixture to Amerindian populations. So this heterogeneity poses a challenge in genetic health issues and establishing clear outlines for diseases and prevention in our community and subgroups. And it also favors negative implications in the demographic data because we might not be counted as a race group. The second thing to point out is that nearly a third of Hispanics in the US are not fluent in English. Many are engaged with translational, but focusing on language alone can fall short, especially when we don't take into account cultural differences within our community itself. We are lumped together into this big category that seems to be homogeneous when it actually isn't. Our community is a melting pot within itself. We are composed of more than 20 countries. We are a multicultural and multi-religious community. And this needs to be acknowledged by care providers and by everybody around us. The third thing to point out is that there is a disproportionate poverty in the Latinx population, with 22% living below the poverty line as compared to white non-Latinx. This decreases our chances of better healthcare access. We have the lowest rate of health insurance compared to other ethnic groups in the country. This accounts for less primary care follow-up, less financial access to screening, and poor overall health outcomes. And the fourth thing to point out is that our community has a large undocumented population, which might be hesitant to seek healthcare due to their immigration status, and further complicates access to healthcare and health insurance.
Those are some important disparities, and I do believe that the Latinx community is not treated with the diversity that it does hold. It's an incredibly large term for such a multitude of communities, and that definitely should be acknowledged, as well as you said, nearly a third of Hispanics are not fluent in English, and that's definitely something that healthcare providers should understand and in part account for, especially since Hispanics are such a huge community in the United States.
That's definitely something that we've been working on. I work as an internal medicine specialist, and I've had the opportunity to work with Latinx patients, and I've noticed that even between us, there are differences in language because I'm a native Spanish speaker. So imagine, the differences and the hurdles that other healthcare providers have to go through to get this information from patients when they're just using a translator that might not be familiarized with the terms or the slang that these patients are using. So it's definitely something important that we have to shed light on, just to, for healthcare providers and for patients themselves to acknowledge that we are a very, very diverse community, and this diversity itself, comes with some challenges.
Definitely, and I'm very, very glad that you brought it up. And speaking of health challenges and health disparities that Hispanics face, what are some health challenges and health problems that the Hispanic community faces that they should keep in mind?
Well, the overall mortality for Hispanics or Latinx is actually lower compared to the counterpart white non-Hispanics. But in spite of lower averages for incomes and worse access to care, we do have some issues that need to be addressed. The average life expectancy in the United States, it's 70 years old. For Latinos in the US, their life expectancy is actually 82 years old. So Latinx immigrants have a higher or superior longevity. And, we're talking about healthcare disparities, and this doesn't sound, as a healthcare disparity. This actually is a good statistic. But there are some indices of health that are pertinent to our subgroups, which actually shed light that we do have several increased mortalities within our community. First of all, 50% of Hispanics will develop diabetes over their lifetime, with more than 50% of them likely to die from the disease compared to their white non-Hispanic counterpart. And this is especially prominent in the Puerto Rican population, which is a subgroup of the Latinx and the Hispanic community. There is support that there's evidence to support that there is an association during the duration of residency in the U.S. among immigrants and the increased rates of diabetes due to obesity. So this is something that's I found very particular and interesting. The matter of the fact that you might have an increased chance of developing diabetes if you are, more culturalized with the US and are living here for a longer period of time. That's something that really caught my attention. And that not all the subgroups are as prone to having diabetes, but definitely 50% is something that's really, really high in our community. And this is a chronic disease that, if it's not taken well care of over time, can have devastating consequences to the health of these patients. Another thing that I wanted to talk about is chronic kidney disease and cirrhosis. Hispanics have a higher prevalence of these two diseases in the community as compared to the counterparts of white non-Hispanics. And this is also important. As I mentioned before, we are the biggest minority group that's uninsured. Chronic kidney disease and cirrhosis are two conditions that, as their name says, are chronic, they're irreversible, and they need constant medical care. So I understand the higher prevalence of this disease, but it's very, very important that we know that our community faces these diseases in order to get better treatment. Another thing is health and health behaviors in our community. They have been studied before, and they're generally worse among Hispanic-borns in the US than compared to Hispanics born outside, with a higher percentage of smoking and hypertension. We all know that smoking is related to innumerable cases and diseases, and hypertension can also have cardiovascular complications. So it's very curious to see how Hispanics born in the US have actually worse health behaviors and health overall itself as compared to others that were born on the outside. They usually attributed to stress-induced behaviors. We are also 3 times as likely as whites and 2 times as likely as blacks to be uninsured. This is something that we've spoken about before, and this upon itself brings numerous issues because people are not insured. They basically cannot afford health care. This becomes a problem in the long run. Puerto Ricans as a subgroup have the highest infant mortality rate with 7.2 compared to other subgroups, and compared to the American, which is 4.3. This is super high. Within the community itself, the rates are equal or even better than white, but Puerto Ricans as a subgroup have a highest infant mortality rate. And this is something to point out, because if we go through statistics and we clump or just bunch up all of our subgroups into just one community, statistically we have a better overall mortality than white non-Hispanic, and a better overall non-mortality in infant death rates. When you break down the statistics per subgroup, you find these issues that become a paradox in healthcare, and they are so important to be discussed because physicians might not be aware of these subgroups and acknowledge these risks in the subgroup communities. Another thing is we have a higher incidence in obesity and gestational diabetes, leading to increased pregnancy and birth complications than non-Hispanic whites. And this, again, is increased in the Puerto Rican subgroup community. Something that works in disfavor is that we are less likely to have documented our end-of-life wishes. complicating healthcare situations where palliative care and end-of-life care are involved. This is something that is not really discussed. We are not brought up talking about what we want in end of life, or if something happens. This is something culturally that is not discussed. So this complicates healthcare a lot. Hispanics are less likely to receive treatment for depression, anxiety, and other behavioral issues than white patients because of barriers to access of care, and most importantly, due to cultural stigma around these issues. Some of these behavioral issues are rooted in stress-related situations due to immigration status, financial instability, traumatic experience, or social support due to families being separated, among others. But the cultural stigma, it's something that I grew up with, and I know everybody in the Latinx community and Hispanic community knows about this. Nobody wants to be called a loco or crazy person just because they have a mental issue. And us as, voices in the healthcare community must stand up and talk about these things, because depression, anxiety, behavioral problems are issues that need to be addressed and needs to be properly treated. This is not about being local or crazy. This is about, an imbalance in your brain that needs to be taken care of by a professional. And there's nothing to be ashamed of in that. So this is something that needs to be, also talked about more in our community. Sexuality is something also that is not culturally openly discussed topic, and this leads to information and higher rates of pregnancy in young females, and also higher rates of sexually transmitted infections. Right now, HIV is the 4th leading cause of death for Latinx, and this was published only in 2016. This is a disease that has been, ravaging the communities for more than 20 years, and still, we have treatment and we have preventive options, but we are still getting targeted for this. And I think part of this is because of the misinformation within our community and our cultural upbringing. And again, Puerto Ricans account for the highest HIV infection rate among the Latinx community in the United States. So this is definitely something to be aware of and to talk about. I have 3 other points that I want to discuss. I know that I've been talking a lot, but as subgroup, disparities are so important to be discussed. So I'm gonna go over these.
No, these have been incredibly enlightening so far, talking about how, just ranging from things like how different Latinx communities, which is what we were talking about earlier, how different communities and just the diversity means that you can't group them all with different communities having different rates, for example, of the infant mortality that you were speaking of, just different health-specific problems like obesity and gestational diabetes, chronic kidney disease, cirrhosis, and talking about more community-based things like an aversion to seeking treatment for depression or anxiety because of just cultural stigma, or sexuality and how that's not a culturally discussed topic and how that can lead to a high rate of STIs, or how the community just has less end-of-life wishes, which can complicate healthcare situations. This has been incredibly enlightening, and I'd love for you to continue and speak more on the other 3 health problems.
So there's also an incidence in liver disease in our population that is the same, but we have a higher mortality associated with chronic liver disease and cirrhosis. And this is accounted to mostly well-documented escalation of alcohol use and misuse in Latinx populations. This is really important. We are a community that, I think everybody, or mostly everyone, anecdotally has grown up with alcohol around them. This is something that our community really is not. We include alcohol in parties and family gatherings and all that stuff, and it's really like normal for us to consume alcohol. Obviously this is done in an appropriate manner where you don't overdrink, but we have a well-documented escalation of alcohol use and misuse in the Latinx population, and this is also related to some behavioral issues and some mental health problems and stress that comes from being here separated from your family, not having enough social support, and these can also take a toll on the Latinx community, especially with chronic liver disease and cirrhosis. If we go back to not being a healthcare insured population, these two diseases also need constant monitoring, medications, and constant follow-up. So it really just goes back to the root of the problem. Also, the overall cancer rates are not elevated if we compare our community to others, but there are still specific disparities related to cancer, specifically cervical, liver, and stomach cancer. It has been shown that females have a late-stage detection in cervical cancer, while males have excess mortality in stomach and liver cancer. And all of these are associated to disease screening, which is very poor. By the time that these individuals get diagnosed, usually the cancer has already advanced. So this increases the mortality for our community. And last but not least is death-related to work injuries. They are higher in the Latinx community and are usually underreported, with foreign-born having up to 59% higher work-related injury death rates than their native-born counterparts. And from all the literature that I reviewed, the reasons behind this stem from immigration status and, again, financial instability or failure to receive proper hazardous training to prevent injuries, which can come from numerous reasons. One of them being, not being English fluent, or just, the fact that you don't want your immigration status to be compromised. Also, when these work injuries happen, they should be taken care of. They should be reported. And, this is also really important because it takes a toll on the family that takes care of this patient afterwards.
Absolutely. And these three, as well as all of the other health problems that you've talked about that the Latinx community face, it's incredible and altogether not surprising, but somewhat saddening how many of these are just related to those health disparities, how so many of these are caused by decreased screening or decreased training or financial instability, which could lead to the decreased screening and just cultural stigma, for example, for mental health or sexuality and sexually transmitted diseases, how those are just culturally stigmatized, thus they don't seek treatment for that, and how many of those disparities play into the problems. And I hope that by addressing these health problems and the disparities that cause them, we can inspire our listeners, especially our Latinx listeners, to actually seek out help, actually seek out screening if they can, and for any of our listeners who are in a position to help make screening and things like those more accessible so that people can be screened, so many of these health problems can be prevented even.
Definitely. This is really important. I was aware of some of these, as a healthcare practitioner, but for me, doing this was a great opportunity to just seek the root of the problem and to see how I and, as a healthcare provider, can work towards changing the narrative and, helping out my community and other communities as well. So it's definitely been something that has given me a chance to just shed a light on these issues and try to see how I can integrate myself and, come up with ways to just help out the community itself.
Absolutely. And I'm glad this has been a learning experience for you as much as it's been a learning experience for me working with you to create this podcast. I've definitely learned a lot of things that I'm going to keep in mind in my future as a healthcare practitioner, different things about culture and screening and accessibility that I'm going to keep in mind. And I thank you. So we've talked about some of the myths that people outside of the Latinx community have about Latin Americans, such as that they're all just one big group where there's so much diversity. It's one of the biggest ones. What are some of the big myths and false beliefs about health within the Latin American community?
Well, there are many, but anecdotally, I've come across a couple that I will mention. I'm sure that there are plenty more, but I will mention a few and just, address them. The first one that I've come across is that when you're diagnosed with hypertension, if you have no symptoms, you do not have to treat this disease. This is totally false. Hypertension is a silent disease that works by increasing the pressure in your vessels and causing damage to them. Sort of like when a pipe hardens. If this pipe hardens, it might break. When you have symptoms, this is a complication from the disease, and sometimes it could cause damage. If you have hypertension, or if you know of someone, if you have a family member that has hypertension, they need to take their medication every day to prevent complications. Serious complications like chronic kidney disease, which we spoke about, heart attacks, problems with circulation. You can even have a stroke. So these are some very, very serious complications from hypertension that you can have in the long run. And sadly, I've seen a lot of patients that didn't know that they needed to take their medication unless they felt flush or unless they felt headache, because they thought that this is something that you treat when you have symptoms, and this is not the case. So it's very important for everyone to know this and, spread the word that they need to take their medications every day. Another one is diabetes and insulin. I've heard so many patients that are afraid to take insulin because they feel like they're going to die off of insulin, or they're going to get complicated. Their disease is going to get worse. The belief mainly is associated to advanced diabetic patients that are transitioned to insulin because their disease is so advanced or poorly controlled. And even though we transition them to insulin, and despite all of this, changes in care, they continue to have disease complications like retinopathy, nephropathy. They end up needing dialysis. Some patients have amputations due to chronic ulcer or to perivascular disease, etc. And they immediately associate the use of insulin with all these complications. This is completely false. The matter of fact is that having high blood sugar levels constantly damages your vessels and your nerves and all of your body. This includes your organs. So when this happens over time, there is damage to the vessels, to the nerves, to all the little vessels in your body that are the size of a hair strand. And this damage, sadly, is irreversible. So when you see a patient that is transitioned to insulin, it's actually beneficial for them. Insulin treats diabetes by lowering the blood sugar levels, and it helps maintain the disease under control. It's definitely not related to increased disease complications, but if the patient has advanced disease, these complications can be slowed down, but cannot really be stopped completely because this damage is irreversible. So it is important to know this difference because you might be scared for your family member, for a person that you know, or for yourself, transitioning from oral medication to insulin. But this is actually beneficial for you. It's going to control your disease. So it's definitely not related to higher mortality or disease complications. And the last one I'm going to mention is something that's really important, and it affects our community. And it's related to STIs, or sexually transmitted infections. I've heard it so many times over my training and my practice is that you can become infected with an STI or even HIV on your first sexual encounter. And this is false. You can get any of these infections if you have high-risk sexual practices, and even if it's in the first encounter. If you have multiple sexual partners, if you start off at an early age, if you practice sexual encounters without proper prophylaxis, like using condoms, you will have the same risk as everybody else, even if it's the first time or not. So this is something that's really important, especially since STIs and HIV have a higher prevalence of infection in our community. We need to know and address these topics. I think this stems from the fact that culturally, we don't get to talk about sexuality with our parents. This is something that's not discussed. It also seems inappropriate when in fact it isn't. We need to talk to our community, and we need to talk to our parents. We need to talk to our children about the consequences of high-risk sexual practices and what happens when you're practicing high-risk sexual encounters without the proper protection or the proper knowledge. So this is something that's really important, and I cannot stress it enough. You need to protect yourself adequately when you're exposed to a sexual encounter, because you have the same risk as everybody else to contract a disease like this. Oh, and one last thing. I've heard from some of the patients also that they're a little bit hesitant about dialysis. What is dialysis? This is an alternative way to free your body of toxins and volume when your kidneys are unable to, for whatever reason. We have a lot of patients that have chronic kidney disease in our community. And sometimes this actually ends up in kidney failure. And in end stage, you are put on a transplant list. And in the meantime, you might need to get dialysis. So there are a lot of complications related to chronic kidney disease itself that might not actually be related to dialysis. But if you are recommended to have dialysis, this will take over the job of the kidneys, or the job that the kidneys had once in your body. So either temporal or permanent, when indicated, is beneficial for the patient. So when you see a family member or somebody in the community that has chronic kidney disease, they might end up in dialysis. And this is not necessarily a bad thing. This is something that they need in order to live. So our community sometimes is a little bit afraid of dialysis because they feel like if you start dialysis, you're going to die. Or because they've known someone that has had complications related to their end-stage renal disease and happen to be on dialysis. And then they pass away, and that they immediately do a relation with the treatment itself when it's not the case. So this is also something that I thought it would be pertinent to mention here.
And all of those are very important myths that I hope our listeners will keep in mind as they look at healthcare and look at their options and what they need to do for treatment. I noticed that a lot of these are mainly education-based, like sex education, or just in general healthcare and treatment education, which treatments are even with dialysis will kill you, which it won't, as you said, and how treatments work. And there seems to be a lot of misinformation on that. And I definitely think that there should be a lot more healthcare education, which is why I'm glad that we have podcasts like this with doctors like you who come on and who help us educate our listeners, so that they know now that you don't need symptoms to treat hypertension, or you're not protected from STIs on your first sexual encounter if you're engaging in dangerous practices. So I want to thank you again for coming on here and talking about these things.
You're welcome. It's definitely been an experience, as you said before, a learning experience, and also, putting together this message for our community. We need to empower ourselves. There needs to be more knowledge. The fact that this podcast even exists, it's amazing. We can get to so many people than just being a doctor in a particular hospital. So that's definitely a great opportunity.
And thank you so much for speaking here. And now that we've talked about some of the myths and some things in that dimension that Latinx people should keep in mind when seeking healthcare, what are some things in general that Latin Americans should keep in mind as they seek healthcare?
I think that they need to be aware of their rights as patients, and that it doesn't matter where you're coming from. You have the right to have healthcare access. For our patients, even if you have an immigration status issue, you still have access to healthcare. Even if you have financial instability and you have an emergency, you are going to be treated in the ED. So these things, I think that the Latin community needs to know. Talk to your healthcare provider about your worries. If you're having financial hardship and you have healthcare issues, or you have immigration status issues, and you do have a chronic disease, it's important that you receive the proper follow-up. There are institutions that can help you cover the cost of your medical bills. So please reach out to us. Reach out to a social worker in your community. We are here to help. We are not going to report you if you don't have an immigration status. That's not our job. Our job is to provide health care to you. And if this is what you need, we are here to provide it. Don't be afraid of just searching or reaching out to a healthcare provider about your issues. Open up about these issues, and also talk to them about your community, because as we mentioned before, we are categorized in this really big community when in fact we have a bunch of subgroups that have their own issues. So talk to them about that. Talk to them about where you're coming from. Talk to them about your family issues, which are so important as well. When it comes to healthcare, we need to know what medical issues your family has. For example, diabetes or hypertension, if your family has always had cancer. Stuff like that is really important to bring to the table when you're receiving care, because it can help us guide your care. And, bottom line is that we have the right as any other patient to receive health care. So please don't be afraid to reach out. In your community, there's various institutions that can help you. We can change the narrative, and we can change those statistics within our community.
Absolutely. And those are some incredible things that I hope our listeners, especially those who are in the Latin American community, keep in mind. As Dr. Rabelo said, be aware that you have the right to health care. If you need to, seek a doctor. If you can, seek a doctor. You will be safe, and it's more important that you are healthy.
Definitely.
And definitely cultural competence is something I've seen come up again and again on this podcast as I've recorded. And yes, talk to your healthcare provider about your culture and some of the things that fit in. Communication is one of the most important things you can do when you're seeking healthcare, is ensuring that the doctor knows what you need. And I hope that any healthcare providers who are listening to our podcast also remember to keep in mind to listen to your patient and listen to their culture and what their background, what they're coming from, so that when you have discussions about treatment and stuff like that, and when those myths that come up that we discussed before, you can understand that where they're coming from, and you can be more understanding when you explain treatments and stuff like that.
Yeah, definitely. It's super important. As you said, like cultural competence is something that it's so important. I cannot stress that enough. In healthcare, especially in this country, we have so many cultures and so many ethnic groups itself. So, and all of them have their particular health issues. So we as providers have, to acknowledge that and have accountability for these things when we're treating patients.
Absolutely. And now coming to some more current time events. How has COVID-19 affected Latin Americans?
Well, as you've heard in the news and statistics overall, Latin American and the Black communities were the most affected by COVID-19, and they continue to be the biggest communities that are affected by this disease right now. I think we spoke about the root of the healthcare disparities in our community, in particular, financial instability, the language issue, just having, that social support and all that stuff. When the pandemic hit, not everybody had the luxury to stay home. I think our community was affected a lot by this. We needed to continue to work. And we were more exposed. Our community has a higher incidence of diabetes. We have chronic kidney disease. We have hypertension. We have obesity. And these are some comorbidities that were sadly, responsible for increasing the risk and the complications of just having COVID itself. So this is something that actually just, affected the Latinx community way more than the white non-Hispanics. In talking about that, I feel like a lot of patients were hesitant to, reach out for treatment or waited for treatment because, of their financial issues or because they didn't have health insurance. I had patients that waited to just get medical care, and they were short of breath, and they were hypoxic, and they ended up coming to the hospital, at a later stage in the disease. And, this disease is very serious, and it has serious complications. So I feel like all of this has, stemmed from the causal root of our health disparities in particular, and it has hit our community in a large way. So yeah, it's been really sad just to see all these issues come to life and work against our community and COVID-19 in particular. So I'm glad we got the chance to discuss all of these issues, the root of the problem, what are the healthcare disparities and the diseases that are more common in our community, so that everybody's aware of what's happening and what puts you at risk. But definitely, I think that overall, our community got really affected because of the fact that, we continued to work because that wasn't an option for us. The exposure was there, and then, the chronic conditions that our community faces sadly worked against us.
Definitely. And I do see that COVID-19 and this pandemic has really shed light on a lot of these disparities. They were somewhat hidden. Only people who were actively looking them out and looking to speak up about them really were the people talking about them. But now that the pandemic and so much coverage has happened, one of the benefits, if you can call it that, is that so much awareness has been spread. And people are definitely a lot more aware that these are the disparities in healthcare for these certain communities. And it allows for moments like these where we can spread even more awareness about more specific things other than COVID-19 that people can keep in mind and spread awareness about, and remember when they have to encounter such problems.
Definitely, this, as you said, this pandemic has, shed light on some issues that the healthcare system in this country has, and sadly that the minority groups like us have had to deal with forever. So, there is something positive about this, is that we are more aware and information is getting out there. Our communities are being empowered by people that are speaking and, taking their time to educate. So we have something positive, to take from the pandemic, but definitely our community has suffered a lot from it.
Absolutely. And speaking of places and people that speak out, I am aware that you have a blog and an IG page called El Rincón de la Internista,
yes,
where you put a lot of things. Was my pronunciation correct? I don't know. I tried.
Close to, yeah. El Rincón de la Internista. It's a little translation would be the internist corner. I started doing that IG page when I was in my last year of residency. In internal medicine, we get to do hospital medicine, and we also get to do outpatient clinic. And that's when I realized that even in my community, I trained in Puerto Rico, born and raised there. I found so many misinformation and just lack of information itself about chronic issues and chronic diseases that patients did not know of. And this is something that's so important. I feel like if you empower your patient, you actually are providing them with tools to better manage their diseases. And information itself it's a powerful tool, but information in healthcare and just being empowered about your healthcare issues is so important, and it actually has a better outcome in the disease itself, just including patients in your plan and just talking to them. Taking that time to just speak to them about their disease in a way that they can understand, it's something that was really important for me. So that's what motivated me to open the IG page. I have a link to the Facebook page as well, because I know that not all of my patient population is familiarized with IG, but they are familiarized with Facebook. So we linked up a page, and I recently opened up a blog a couple of months back because I thought that, I could put up more information. It's a web page. So yeah, trying to, do my work, giving back to the community, information that they can understand, and, that's information that's reliable. So yeah, that's my little project.
And it's an incredible, inspiring, and noble project, and I really have a lot of respect that you do that. I know internal medicine is a pretty demanding job, and on top of that, you have this page where people can get information, and I find that really, really inspiring and cool.
Thank you so much. Yeah, I've been trying, to do my part and just give back to everyone, that's helped me throughout my career. And I think, just giving out patient information for healthcare and their diseases is really important, and it has a great impact on their overall health and, the way that they feel. And, giving them tools to work with their disease is something that's very gratifying. So thank you.
Thank you. And now we've talked a lot today about healthcare disparities, and some of the health problems faced by the Latinx community. We talked about how the Latinx community isn't just this blob that we kind of make it, how it's so diverse and multicultural, and that should be something that's kept in mind. Some of the myths and false beliefs within the community about healthcare, and some of the things they should keep in mind, as well as some of the things that healthcare workers should keep in mind while treating Latinx patients. And we also talked about how COVID has affected Latinx and how that's really been shining a light on some of these disparities. And we also talked about your wonderful blog. And I was wondering, do you have anything else you'd like to add to our conversation?
I would definitely just say overall that just for everyone, like a general message, we are a community that's very varied. Just acknowledge all the differences, be aware of all the issues that we mentioned before. You don't have to know everything, but if you have a patient that is from our community, just ask where they're from, just to try and get a better idea of their background and their beliefs. What are the things that they prefer? It's always important to include the family. We are, like, our culture is very family based. So you will see that the whole family wants to know what's going on. Ask the patient if they feel comfortable about it, and involve the family in the healthcare. That's so important to us. Obviously, if the patient agrees. And this is something that you'll see. I've seen many healthcare providers being a little bit annoyed, with the fact that they think that the family is meddling, or just that there's a lot of family members. We come from really big families, and everybody wants to know what's going on. That's part of our culture, and being culturally educated, you can come to understand that everybody means well, and they're just being worried about their family member. So just having that, taking that into account, and just trying to provide the better care for your patient includes, taking consideration of their cultural background. And as for patients, we have the right to have access to healthcare. It doesn't matter where you're from. It doesn't matter if you speak English or not. So be aware of that. Don't be afraid to reach out. In whatever situation you are, we're more than happy to help and provide you the healthcare that you deserve. So, be a voice in your community and reach out to people that need it. So we can have the same healthcare as everybody else, and we can change our narrative and, work towards bettering our statistics as a whole group.
Definitely, and that's very, very important closing words to end with. And I want to thank you again so much for coming on here, for helping us spread this awareness, for educating us. I've definitely, as I said, had a very educating experience working with you, learning all of these statistics and all of these facts, and just this experience has been invaluable, and I want to thank you again. And I hope all of our listeners also have come away with as much as I've learned, that these disparities are definitely something that should be kept in mind, should be understood, and if they apply to you, make sure that you remember them, that you are seeking healthcare when you need to seek healthcare, and ensure that you will be taken care of, that there is changes in the system that in the past admittedly hasn't been very fair, but there are changes that are happening that will ensure that you are taken care of.
Definitely. It was a pleasure just working with you and working with this effort in order to help our community and help spread the word.
So thank you again for so much for helping us out. This was Dr. Nikita Rabelo. My name is Pragya Chaudhary. We are Health Needs RX. Thank you so much for listening. Have a great day.